BBC Verify's Tom Edgington has been assessing how the policy could work.
The Conservatives have unveiled plans to cut a cumulative £47 billion a year from government spending. Now, the Tories want to present themselves as a party of fiscal responsibility and aspiration. But what is going on behind the headline numbers? Well, in the context of total public spending, £47 billion is not a huge number, especially when you consider that it's a saving spread over 5 years. So it works out at about £10 billion annually. That means, when compared with overall government spending, which is currently about £1.3 trillion a year, these cuts represent just over 0.5% of total annual spending. But it's certainly true that government spending as a proportion of national income has been rising steadily over many years, and that's something the Conservatives say needs addressing. Now, as part of the savings, the Tories believe that they can cut £23 billion from welfare, and that's a much more ambitious target than the £12 billion they pledged to find at the last election. Key to that is what the Shadow Chancellor called a fairer system that means only British citizens could access welfare. However, soon after Mel Stride made his conference announcement, BBC Verify was told the policy would not apply to European nationals with settled status. Now, that's because the European Union Withdrawal Agreement, which was introduced after the Brexit vote, provides certain protections, and government figures show there are 770,000 people claiming universal credit with EU settled status. But it remains unclear how many people overall might be affected by the policy. The Conservatives were unable to provide a figure when asked. Now, the party also wants to stop welfare claims from people with what it calls low-level mental health conditions, saying that treatment and support would help more than payments. Now, claims for these conditions are rising. According to researchers, mental and behavioural disorders accounted for 44% of all claims in 2024. Now, that is up from 39% back in 2015. Researchers say that the reason for the rise isn't clear, but reduced stigma around mental health and the legacy of COVID may play a part. But some critics suggest that assessments have become too easy, with some being coached beforehand. Now, the party hasn't set out how much extra money it wants to set aside to allow more people to access treatment. And the Conservatives do insist that their policies are about fairness. But the test will be whether these savings can be achieved by getting more people into work and not increasing hardship.